So you're thinking about stopping your GLP-1 medication. Whether you're on Ozempic, Wegovy, or Zepbound, the idea of coming off these drugs can feel intimidating. Let's walk through why you might want to stop GLP-1 medications and what you should know before doing it. First, why would you want to stop taking these medications in the first place? One of the biggest reasons people stop is insurance, or more accurately, the lack of it. These medications are expensive, and without coverage, paying out of pocket simply isn't realistic for many people. There are assistance programs like NovaCare or Lilly Direct that can help lower costs, but even those options can still be pricey. There may be some relief on the horizon though. The White House has announced agreements with Eli Lilly and Novo Nordisk that could significantly lower prices for drugs like Ozempic, Wegovy, Zepbound, and Mounjaro through a new Trump RX platform. Another very common reason for stopping, or at least pausing, GLP-1 medications is side effects, especially gastrointestinal ones. Nausea, vomiting, diarrhea, and constipation are the most frequently reported issues. For some people, these symptoms aren't just annoying, they can become severe. I've seen patients develop hernias from straining due to constipation, or deal with relentless nausea and vomiting that makes daily life miserable. If side effects reach that point, GLP-1 medications may no longer be a good fit, even though newer drugs are being developed that may help reduce these issues when taken alongside GLP-1s. Changes in medical status are another important reason to stop. Pregnancy is a big one. GLP-1 medications are not recommended during pregnancy, largely because we don't yet have enough safety data to know how they affect a developing fetus. Weight loss itself is also not advised during pregnancy. Animal studies have suggested potential risks to fetal development, and although limited human data haven't shown a clear increase in major birth defects with early exposure, the evidence just isn't strong enough to say that these drugs are safe during pregnancy. If you're planning to become pregnant, it's generally recommended to stop GLP-1 medications at least 1 to 2 months beforehand to allow the drug to fully clear from your system. Other medical changes can also prompt discontinuation, such as a new cancer diagnosis or the need to start a medication that could interact with your GLP-1 drug. In many of these situations, stopping isn't usually because we know for sure GLP-1s will interfere with your other medication, but because we just aren't sure. Some people stop simply because they want to see if they can maintain their progress on their own. Others feel the medication has stopped working. Typically, GLP-1 drugs lead to significant weight loss over the first 30 to 40 weeks. After that, things tend to slow down. Between weeks 40 and 56, weight loss often plateaus, and by around week 56, many people begin to regain weight, even though the dose hasn't changed. This gradual regain can continue, which can be frustrating and may lead people to question whether staying on the medication is worth it anymore. So what happens if you do stop? Let's look at what the research shows. In the Step 4 trial, participants took Wegovy for 20 weeks and lost weight as expected. After that point, some continued Wegovy while others were switched to a placebo, essentially stimulating stopping the drug. Once Wegovy was discontinued, weight regain began almost immediately. That regain continued steadily all the way through week 68, with no sign of slowing down. By the end of the study, people who stopped Wegovy had regained about 65% of the weight they had lost during those first 20 weeks. So how should you approach things if you've decided it's time to stop your GLP-1 medication? The first and most important step is to talk to your doctor. They know your medical history and are best equipped to help you come off the medication safely and thoughtfully, rather than leaving you to figure it out on your own. In most cases, the best approach is to go lower and slower. That means tapering the medication instead of stopping it abruptly. Think back to when you first started your GLP-1. You didn't jump straight to the full dose. You worked your way up in steps. Coming off works the same way, just in reverse. You reduce the dose gradually, pausing at each lower step to see how your body responds. Are you feeling much hungrier? Is your weight starting to creep up? If so, you address those issues first and aim to stabilize before dropping to the next lower dose. The goal is to keep hunger under control and prevent too much weight gain at each step. Another option is to stretch out the time between doses. Instead of taking the medication weekly, you might skip a week, then move to every 2 weeks, and eventually to once a month. At each increase in spacing, you check in with your body and your weight before going further. Again, the key idea is patience. Slow changes give your body time to adjust. You can also talk to your doctor about switching medications. There are several effective weight loss drugs that are not GLP-1s, and many of them are much more affordable because generic versions are available. These medications work in different ways, and each has its own pros and cons. I've covered many of them in more detail elsewhere, linked down below, but the important point here is that stopping a GLP-1 drug doesn't mean you're out of options. It's also important to manage your expectations. A small amount of weight regain is very common and honestly expected when coming off GLP-1 medications. And that doesn't mean something has gone wrong. If you regain 5 or even 10% but still keep most of the weight off, you're still ahead of where you started. The goal of tapering slowly is to prevent a slippery slope where a little regain turns into a full rebound. For many people, watching the scale tick up even slightly can be emotional, and that's understandable. Try to zoom out and look at the big picture. Think of your weight loss journey like climbing a mountain. You've already climbed hundreds, maybe thousands of feet, and that took planning, effort, and persistence. Taking a short step downhill to regain your balance doesn't erase the whole climb. It just means your body's adjusting to new terrain now that a tool has been removed. What matters is how far up the mountain you still are. Once you understand that some regain is normal, the next rule is simple. Don't change your lifestyle. Stopping the medication doesn't mean stopping everything else that worked. Keep eating structured meals and sticking with a nutrition plan that helped you lose weight in the first place, whether that means tracking calories or limiting carbs. Keep moving your body with both cardio and strength training. Don't let exercise fall off just because the medication is gone. Stay connected to your support system, whether that's a weight loss program, a coach, or a group that helped keep you accountable before. Consistency matters more than perfection. What you want to avoid is replacing the medication with unhealthy coping habits, like drinking more alcohol or using marijuana to manage stress or appetite. Those habits can quietly undo a lot of the progress you've worked so hard to achieve. At the end of the day, GLP-1 medications are just one tool in the toolbox. They don't define your entire weight loss journey. Stopping them isn't the end, it's just transition. The medication may have helped open the door, but you're the one who walked through it. Even if continuing the medication is beyond your control, your progress, your habits, and your momentum moving forward in the future remain firmly in your hands. Hi, I'm Dr. Brian Yeung. I'd love to hear your thoughts. Feel free to share them in the comments down below. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. And if you know someone who could benefit from this, please share it with them. Finally, if you enjoy what we do and want to learn more, consider supporting us on Ko-fi, and be sure to check out our other socials as well.